A 74-year-old man sat in my office, his hands trembling not from disease but from something far more common and far more silent. He looked me in the eye and said, "I didn't know. I was hurting myself." For years, he'd done what millions of men do in private without ever realizing the quiet damage it was doing. And he's not alone. I'm Dr. Benjamin Carter, a urologist and men's health specialist with over 30 years of experience helping men over 60 stay strong, confident, and sexually healthy. My mission isn't just to treat symptoms. It's to empower you with knowledge, to help you understand your body, and to guide you toward a healthier, more fulfilling life. I'm here to tell you what most doctors won't. After 60, masturbation changes. And if you don't adapt, it can quietly affect your body, your mind, and even your manhood. You've been told it's natural, harmless, even healthy. But what if I told you that how you do it matters more than you think? In this video, I'll share 5 critical masturbation secrets that older men wish they'd known sooner. Truths that could preserve your circulation, protect your prostate, and even reignite your confidence. And stay with me until the end, because the final secret could change the way you age, connect, and live for years to come. Before we get started, if you're serious about improving your sexual health naturally and aging with strength, make sure to subscribe and turn on notifications so you never miss a practical doctor-backed tip designed specifically for men like you. And if this message resonates with you, type 1 in the comments. If not, type 0. Your feedback helps me make this content more helpful for you. As men age, our bodies change. This isn't a weakness. It's a natural progression that requires a different approach to self-care, including our private habits. Many men carry the habits of their youth into their later years, unaware that what was once harmless or even beneficial can subtly become detrimental. The biggest misconception I encounter in my practice is the belief that once you hit a certain age, any changes to your penile health are irreversible, or that masturbation remains a completely neutral activity regardless of technique or frequency. Many men believe that issues like erectile dysfunction, reduced sensitivity, or urinary incontinence are simply part of aging, and that the only solutions are pills or complex medical procedures. This couldn't be further from the truth. Let's dive into the physiological and emotional roots behind this. Your penis, at its core, is a vascular organ. Erections depend on healthy, robust blood flow. As we age, our blood vessels naturally become less elastic, a process called arteriosclerosis. This is compounded by factors like diet, exercise, and stress. If your masturbation habits involve excessive friction, aggressive techniques, or an over-reliance on very specific, narrow types of stimulation, you can inadvertently contribute to microtrauma or desensitization over time. This isn't about direct damage from one instance, but the cumulative effect of a pattern that might compromise the delicate endothelial lining of your blood vessels or dull nerve sensitivity. Consider the case of Robert, a 68-year-old retired engineer who came to me experiencing increasingly soft erections and a noticeable drop in sensitivity. He was frustrated, attributing it to just getting old. After a thorough medical evaluation, we found no underlying systemic diseases. When I gently inquired about his private habits, he admitted to a very frequent, highly repetitive masturbation routine, often several times a day, using a very specific, aggressive grip. He'd been doing this for decades. He saw it as a quick release, a way to de-stress. What he didn't realize was that this constant, intense, and narrow form of stimulation was effectively overworking and desensitizing the very nerve endings and vascular responses he needed for natural arousal. His body was adapting to extreme input, making normal, gentler stimulation less effective. Emotionally, he felt disconnected from his partner, even though he loved her deeply. His private habit intended for release had become a barrier to intimacy, fostering a sense of inadequacy and isolation. He thought he needed more oomph to feel anything, not realizing he was creating the problem himself. This brings us to the first critical secret. Secret 1. The danger of over-reliance on high-intensity, repetitive stimulation. Many men, especially as they get older and perhaps experience some natural decline in sensation, tend to increase the intensity or narrow the focus of their masturbation technique. They might use a very tight grip, or focus exclusively on one very small area, or use excessive speed. This can lead to desensitization of nerve endings over time, making it harder to achieve arousal and orgasm with gentler, more natural stimulation, including during partnered sex. It can also, in extreme cases, contribute to microtrauma to the penile tissues and blood vessels, impacting their long-term health and elasticity. Your body adapts to the stimulus you provide. If that stimulus is always extreme and narrow, your body learns to only respond to that, leaving you feeling less from natural touch. Actionable solution: practice mindful masturbation. Set aside time when you won't be rushed or interrupted. Before you begin, take a few deep breaths to center yourself. Pay attention to every sensation, from the lightest touch to increasing pressure. Explore different speeds, pressures, and areas of stimulation. Notice how your body responds. Are there new sensations? Are old ones returning? What feels good without necessarily leading to orgasm? Use a lubricant if needed to enhance comfort and sensation. The goal is to cultivate a deeper connection with your body, to rediscover what brings you pleasure, and to appreciate the journey of arousal, even if it doesn't always culminate in ejaculation. This re-engagement with varied sensations can help restore nerve sensitivity and promote healthier blood flow responses. This leads us directly to Secret 2, neglecting your pelvic floor muscles. Many men are unaware of the crucial role their pelvic floor muscles play in erectile function, ejaculatory control, and even urinary health. These muscles, often strengthened through exercises like Kegels, are essential for maintaining blood within the penis during an erection and for controlling ejaculation. When masturbating, especially with aggressive techniques, men often inadvertently strain or misuse these muscles, or simply neglect to strengthen them. This can lead to a weakened pelvic floor over time, contributing to issues like softer erections, premature ejaculation, or post-void dribbling. Imagine trying to hold water in a leaky bucket. A weak pelvic floor is like that leaky bucket for your blood flow during an erection. Actionable solution: incorporate daily pelvic floor exercises, often called Kegels, into your routine. To find these muscles, imagine you're trying to stop the flow of urine midstream or trying to prevent passing gas. The muscles you clench are your pelvic floor. Be careful not to clench your buttocks, thighs, or abdominal muscles. The movement should be internal and subtle. Here, how to practice them. Slow holds. Contract your pelvic floor muscles, hold for a count of 5 seconds, then slowly relax for 5 seconds. Repeat this 10 to 15 times. Focus on a complete relaxation between contractions. This builds endurance and strength. Quick flutters: quickly contract and relax your pelvic floor muscles. Do 10 to 15 rapid contractions. This builds responsiveness and quick control. Aim for 3 sets of these exercises daily, perhaps morning, noon, and night. You can do them anywhere, sitting in traffic, watching TV, or even lying in bed. Consistent practice over weeks and months will yield noticeable improvements in erectile firmness, ejaculatory control, and urinary continence. This isn't about immediate gratification. It's about building lasting strength. Now for Secret 3, the peril of overfrequency and ignoring your body's signals. In our youth, our bodies are often more resilient, capable of bouncing back quickly from frequent activity. After 60, however, recovery times lengthen. Excessive frequency of masturbation, especially if it leads to discomfort, soreness, or a feeling of diminished returns, can be counterproductive. It can put undue stress on the prostate, potentially exacerbating symptoms in men with benign prostatic hyperplasia, BPH, or chronic pelvic pain. More importantly, it can drain your physical and mental energy, leaving you feeling lethargic or even irritable. Your body needs time to replenish neurotransmitters and energy stores after orgasm. Pushing it too hard, too often, can lead to a state of chronic fatigue or diminished pleasure. Consider the story of Frank, a 72-year-old former athlete. He'd always been highly active, and in retirement he found himself with more free time. He started masturbating multiple times a day, sometimes out of boredom, sometimes out of habit. He noticed he was feeling increasingly tired, his erections were less firm, and he had a persistent, dull ache in his perineum. He felt ashamed to bring it up. When he finally did, we discussed how his high frequency was overtaxing his system. His body simply wasn't recovering between sessions, leading to a state of chronic low-grade inflammation and fatigue. He wasn't giving his tissues, nerves, or even his brain the necessary rest. Actionable solution: listen to your body and prioritize quality over quantity. There's no magic number for too much, as it varies for every man. However, if you're experiencing soreness, reduced sensation, fatigue, or if your masturbation habit is interfering with other aspects of your life, sleep, social engagement, energy levels, it's a sign to reduce frequency. Try taking a break for a few days or even a week to allow your body to reset. When you resume, focus on making each experience more mindful and pleasurable, rather than simply a quick release. Consider masturbating only when you genuinely feel a strong desire, rather than out of habit or boredom. This allows your body to fully recover, potentially leading to more intense and satisfying experiences when you do engage. This leads us to a deeply emotional truth, Secret 4, using masturbation as an escape or coping mechanism. Not long ago, I sat with a retired veteran in his late 70s. His name was Howard. He wasn't there because of a medical emergency. He came in because, in his words, "I just don't feel anything anymore." Not just sexually, but in general. At first, he thought his struggles were physical, but the more we talked, the more it became clear. His habits weren't about desire. They were about something deeper, quieter, and more emotional. He had been masturbating almost every night, not out of lust, but as a way to cope. He didn't even realize it had become his way of managing sadness, sleep problems, even loneliness. That moment changed how I saw him and how he saw himself. This is a truth I wish more older men knew sooner. Masturbation in your 60s and beyond isn't just about physical release. It's tied to your brain, your emotions, your nervous system. After orgasm, your body releases powerful chemicals: dopamine, serotonin, oxytocin. These chemicals regulate sleep, reduce anxiety, and improve mood. While this can be beneficial, if it becomes your only or primary coping mechanism for emotional distress, it can create a cycle. You might avoid addressing the true sources of your loneliness, anxiety, or boredom, substituting genuine human connection or healthy coping strategies with a solitary, temporary release. This can lead to a quiet erosion of intimacy in relationships, a feeling of emotional emptiness, and even a sense of shame or isolation. Actionable solution: address the underlying emotional needs. If you find yourself turning to masturbation primarily out of boredom, loneliness, stress, or anxiety, it's a signal to explore healthier coping mechanisms and seek genuine connection. This might involve reconnecting with friends, joining a club, pursuing a new hobby, spending more time with your partner, or even seeking professional counseling. Sometimes a brief period of abstinence can help you identify the emotional void you're trying to fill. When Walter began to reconnect with himself gently without pressure, his mood lifted. He slept better. He smiled more. He wasn't chasing youth. He was reclaiming dignity. That's what masturbation can become in later life. Not an escape, but a return, a way to say, "I still matter." Finally, we arrive at Secret 5, the hidden damage of insufficient lubrication and roughness. As men age, our skin, including the delicate skin of the penis, becomes thinner and less elastic. Natural lubrication can also decrease. Many men, either out of habit or ignorance, continue to use dry hands or inadequate lubrication during masturbation. This can cause micro-tears, irritation, and over time, contribute to a condition called lichen sclerosus, a chronic inflammatory skin condition that can lead to scarring, reduced elasticity, pain, and even narrowing of the urethra or changes in penile curvature. It also contributes to general desensitization and discomfort, making the act less pleasurable and potentially damaging to the delicate vascular and nerve structures. This isn't just about comfort, it's about preserving the integrity of your tissues and nerves. Actionable solution: always use a high-quality, body-safe lubricant. Water-based or silicone-based lubricants are generally recommended. Apply generously to ensure smooth, friction-free movement. If you notice any discomfort, redness, or changes in the skin, stop and consult a urologist. Be gentle with yourself. Your body in your 60s is not the same as your body in your 20s. Treat it with the care and respect it deserves. This simple act of using lubrication can prevent significant long-term issues and enhance pleasure, making the experience more comfortable and healthier for your penile tissue. When you implement these changes, practicing mindful masturbation, strengthening your pelvic floor, respecting your body's recovery time, addressing emotional needs, and using proper lubrication, the benefits extend far beyond just your sexual health. You'll likely experience improvements in erectile firmness and duration, better ejaculatory control, and a reduction in urinary symptoms. But more profoundly, you'll feel a renewed sense of confidence, self-respect, and connection, both with yourself and with your partner. This isn't about giving something up. It's about transforming a habit into a practice that supports your holistic well-being. It's about reclaiming your vitality and believing that you deserve a rich, fulfilling life, regardless of your age. And now that you've heard all 5 secrets, there's one final truth that ties it all together. One message that goes beyond science and medicine straight to the heart of what it means to age with strength, confidence, and self-respect. This isn't just about masturbation, it's about self-compassion. The ultimate secret is to approach your body, your desires, and your journey with kindness and understanding. Too often, men are hard on themselves, expecting their bodies to perform as they did decades ago. But true strength comes from adapting, from learning, and from nurturing yourself with grace. This means accepting changes, seeking knowledge, and making conscious choices that support your well-being, rather than clinging to old habits that may no longer serve you. It means understanding that your sexual self is an evolving part of your identity, and that embracing this evolution can lead to a deeper, richer, and more satisfying experience of life. You won't want to miss this. If this video helped you understand your body better and empowered you with new strategies for health, please share it with another man who might need to hear this message. Your health journey is a shared one, and together, we can empower more men to live healthier, more confident lives. And don't forget to subscribe to my channel, because I'll be sharing more doctor-backed advice made especially for men like you. Leave a comment below and let me know which of these 5 secrets resonated most with you, or if you have a question. You've taken the first step towards reclaiming your vitality and confidence. Now, keep going. Your best years are still ahead, and you deserve every one of them full of health, strength, and satisfaction.